our belly disconnected.
Hi, very good evening. So, so today we'll have a discussion from oral surgery, right? So we have selected few multiple choice questions. In fact, I've shared one image-based question also, right? So you can go through the soft copy which is present in your Google group, right? Anyways, we'll have further discussion on the same now. So today, as I said, we'll be dealing with oral surgery. So once again, a very good evening. So we'll have live session till 6:15 maximum, fine? And then if this completes our this week's live sessions. So first of all, a very good evening all of you. Hi Shilpa, hi Kirti, Mausumi, Sunita, Amina, hi. Hi Ajaj, hi Indu, hi Sujay, Ananya, hi, very good evening. I'm seeing a few new people today. I think 5 to 6 p.m. is suitable for a few, isn't it? And if I start a live session at 10:30 or 11 p.m. in the night, I can expect more and more students obviously, because most of us are night owls, isn't it? So we'll right away start with our discussion. Hi Ramyasri, a very good evening. So we'll proceed with the first question. I have given you four statements and I've asked you to find out which these statements suit. Like, in other words, the following statements are true for. So the statements include: keep the end of the handle in the palm of the hand, keep the wrist straight, chair has to be reclined 30 to 35 degrees to the floor, and tooth should be at the height of the elbow. So I've given you four statements. I've asked you, these statements are true for option A, maxillary extractions; option B, mandibular extractions; option C, both; Option D, none. So the statements are, keep the handle or keep the end of the handle. We're talking about the extraction forceps. Keep the end of the handle in the palm of the hand. Keep the wrist straight. And chair has to be reclined by 30 to 45 degrees. I'm sorry, 30 to 35 degrees, it's not 45 degrees. And fourth statement is, tooth should be at the height of the elbow. So this particular operator position is maintained for maxillary extractions, mandibular extractions, both, none of them. I'm sorry for those barking sounds. Yes, Rohit, very good evening. Yes, Sananya, Rohit, Ajaj, Amina, good. So obviously, these suit for maxillary extractions, isn't it? You might have practiced few extractions in your undergraduate level, at your undergraduate level. So along with that, what would be the positions if at all you're planning for mandibular extractions? So the question includes various statements pertaining to or relevant to maxillary extractions. So if at all planning for extraction of mandibular teeth, what positions have to be followed? Or how would you modify the given statements from the question? Yes, Indu, Vishaka, Sunita, yes, it's maxillary. Yes, Anami, occlusal plane has to be parallel to floor, and to achieve this, the chair has to be inclined at 45 degrees, isn't it? Good. So what is occlusal plane parallel? Yes, Vishaka. And the handle of the instrument has to be held completely in your palm. No, not the end of the handle, but entire handle has to be grasped, isn't it? And obviously, when compared to maxillary extractions, for mandibular extractions, the chair has to be at a lower position, isn't it? And as we discussed, chair has to be reclined at 45 degrees. And is there any change in position? For example, you are a right-handed operator, you are trying to extract maxillary teeth. Where do you stand? Left of the patient or right of the patient? If you're planning for maxillary extractions. If you're a right-handed operator, obviously you stand to the right of the patient, whether it is maxillary left or maxillary right, isn't it? Yes, you're right, Vishaka, and as you rightly said. So we obviously stand on the right of the patient and then follow this protocol. If at all you are planning for mandibular extractions, where do you stand? If you are a right-handed operator, for mandibular extractions, where do you stand? Yes, Akash, you're right. So what about mandibular extractions? Yes, we obviously stand front. Is it right front or left front? Yes, we stand right to the patient again. Good. Right front if you're planning for extractions pertaining to third quadrant. What if you're planning for extracting teeth from fourth quadrant? Where do you stand? So right front is for third quadrant. What about fourth quadrant extractions? Mandibular extractions or fourth quadrant extractions? Hi Ratu, very good evening. Exactly, I'm waiting for that answer actually. Yes, Indu, we obviously stand behind the patient, isn't it? Good. We stand behind the patient for fourth quadrant. We stand behind the patient, hold the jaw with three fingers, with with your index finger and your thumb in your oral cavity, and then you place the other finger beneath the mandible to stabilize it, isn't it? So fourth quadrant, we stand behind the patient. Yes. So keep these things in mind, very minute details, but yet very important clinically, right? So we often tend to get confused. So imagine as if you're extracting teeth, it will be easy for you to remember. So for extracting maxillary teeth, so keeping the end of the handle, suppose this is a handle, keeping the end of the handle in the palm of the hand and the fingers, and the wrist has to be placed straight if you're planning for maxillary extractions. And you have to stand onto the right, obviously, and chain has to be inclined 30 to 35 degrees for maxillary extractions, and tooth should be at the level of the elbow, right? And we use finger and thumb to support the tooth as well as alveolus. And for mandibular extractions, we keep the handle well along the we keep the hand well along the handles, right? We hold the forceps something like this. And then if you are extracting a left mandibular teeth, we stand in right front position as you said. And if you're extracting right or fourth quadrant teeth, we stand behind the patient, isn't it? And when compared to maxillary extractions, the chain position for mandibular extractions has to be lower. And finally, we use two fingers and thumb to stabilize the mandible for mandibular extraction. So very simple. So the following statements which I mentioned are relevant for option A, maxillary extractions, right? So you can expect these kind of questions as well. Yes, Vishak, as you rightly answered, 7 o'clock question. It can be used for maxilla or mandible, mandible left quadrant or third quadrant. Now let's move on to the second question. And by the way, remember these positions are exclusive for your exodontial extractions. But again, for impression making in prosthodontics or cavity preparations in conservative, we altogether have altered or different kind of operator and chair positions, which we discussed in detail in one of the videos in YouTube and e-classes. You can refer that for more information. And second one, complications of tooth extraction include all except. So what are the complications of tooth extractions except? Option A, fractured crown. Option B, dry socket. Option C, myofascial pain dysfunction syndrome. Option D, none of the above. So complications of tooth extraction include all except. I'm sure majority of you would land in soup. So consider this as a challenge and let's see how many of you are going to answer. Yes, Mukesh, Malavika, Priyanshi, hi. Okay, let's deal with all the complications in brief. Anyways, we'll have a separate video on the same in e-classes. So we have something called as local complications and systemic complications, right? Again, in each local and systemic, we further have immediate complications, delayed complications, and again late complications, right? So I'll just summarize. Anyways, before summarizing, I'll put you one question, try answering how many ever you can. So give me some examples for immediate local complications. The moment you extract teeth, what are the immediate local complications? Hi Priyanshi, hi Priyanka Chauhan, hi, very good evening. Hi Bernice. So what could be the immediate local complication after extraction? Hemorrhage? Yes, hemorrhage could be one reason. Infection obviously takes time, right? So infection takes time. Syncope, okay. Wrong tooth extraction, agreed. That's a very rare scenario, right? Okay. A fractured tooth, fractured root, isn't it? So the examples for immediate local complications include fractured crown, fractured root, fractured alveolus, fractured tuberosity, right? And also there can be fracture of mandible in some cases, or even fracture of adjacent tooth, right? As you all mentioned. And also there can be tearing of soft tissues like gingiva, alveolar mucosa, and also there can be, if at all you're planning for extraction of upper molars, there can be oro-antral communication with the sinus, isn't it? So oral antral communication and even fractured instrument. If at all you're trying to engage any file or any instrument, there can be fractured instrument also, right? So these all come under immediate local complications. Good, good. Even this oro-antral communication also comes under, yes, nerve injury and all, fine. Now, give me some examples for Since you answered now immediate local complications, what could be delayed local complications after extraction? Delayed local complications. Excellent. So obviously one is dry socket, trismus, local infection as one of you rightly mentioned previously, secondary hemorrhage, right? So these can be cited as examples for delayed local complications. Exactly, delayed bleeding, secondary hemorrhage and all. Good. Now, since we have covered immediate and delayed local complications, now let's deal with immediate and delayed systemic complications. So give me some examples for immediate, systemic, regional or distant complications. Hi Toffee, welcome. Toffee, say hi. I think we lost Par. Toffee. 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 Hmm. Hmm. Toffee, 2 minutes. Toffee, 2 minutes. Okay, give me 2 minutes. I will see if we can any alternate light. Okay, just give me 2 minutes. Okay, is it streaming or is it still breaking? And can you see anything? Okay, you can't see anything, but you can. Can you hear? Okay. Okay, it seems to be dark completely. Anyways, we'll see if we can continue. But can you hear? Can you hear me clear? Okay, so audio is clear but no video. So okay, we'll try this new format then. Fine. So as we have been discussing, I think the culprit here is toffee. The moment toffee entered, we lost power. Okay, fine. I think we are in, yeah. So anyways, give me some examples for immediate, distant complications. So previously we have covered local complications, right? Yes, you said anaphylaxis. Good. Yes, anaphylaxis could be one reason, one complication. Yeah. Along with that, crushing or burnt lip, injury to nerves, which can lead to regional or distant complications, right? And also lacerated tongue, swallowed or inhaled instrument. So all this come under. Okay, Mr. India, fine. So examples for immediate symptoms include injury to lingual nerves, lacerated lips or burnt lips or lacerated tongue or palate or swallowed or inhaled instrument or tooth. Now, come to delayed regional or distant complications. Obviously, it has to be spreading infection, right? So, any infection, it can be even injection tract hematoma. We have something called as injection tract hematoma. So, along the path of movement of needle, there can be hematoma later. So, that comes under delayed distant complication. And even myofascial pain dysfunction syndrome comes under delayed regional or distant complication. Do make a note of it. So even myofascial pain dysfunction, because of continuous opening or because of any trauma to muscle, when you give LA, there can be spasm and development within the muscle, NPDS. So even NPDS is one of the complications of the extraction, right? Okay, voice also is breaking. So is it still breaking or how is the quality now? I'm sure there is no video, right? Okay, voice is also breaking. Is it only for Sanjay or is it for everyone? Video is lost completely. No, I hope it's fine again, right? So, anyways, we'll see whatever we can complete, we'll try to complete, right? So, because the reason again go out of station after 6:30 and 7, we'll see, right? So coming to the question again, complications of include all except. So fractured crown is a local immediate complication, dry socket is a local delayed complication, and myofascial pain dysfunction comes under delayed systemic or regional complication, right? So option D is more appropriate. Even NPDS is included as one of the complications after extraction. Yes. So before, hi everyone, we are able to broadcast video. Mail reason, but it's fine. We can continue with it. So let's move on to the third question. So we have, if you observe, so I have placed an image of skull wherein you can see three lines.